models for lower limb. So this is the new one, this is the old one. And I'm gonna use both of them in your test. So that's why you need to practice in all of them. It's possible to use those mannequin as well. So whatever I'm telling in this one will be almost similar in the other model as well. Okay, so for thigh, we will have 4 parts: posterior, anterior, lateral, and this is the medial part or medial compartment. I'm gonna start with the easiest part, which is lateral area. For lateral area, we have only one muscle, which is called tensor fascia latae. So this is the muscle, and this is called as a ITB or iliotibial band, this white part. For anterior part, we will have this muscle. You are very loud, guys. So this is the sartorius. What's important about this? Not the function.
Like 3 functions.
Why is it important? This muscle is the longest skeletal muscle in our body. It's called as a sartorius, and function of that will be flexion of the leg, flexion of the thigh, and lateral rotation. The other muscle which we have in anterior compartment is called quadriceps femoris. It has 4 heads and 1 tendon which is attaching to the tibial tuberosity. So this one is coming from hip. It's called rectus femoris. I'm gonna just gently remove this. And you can see 3 other heads which are called vastus heads. Vastus medialis, vastus lateralis, vastus intermedius. So in your test, if there is a muscle with more than 1 head, you're supposed to memorize the name of different heads as well. So in test, if I put the label and you said that's the quadriceps femoris, you're going to get partial credit because this is the vastus medialis. Okay. Same thing for the other heads as well. Let me just put this back. Okay. So after anterior part and lateral part, we are going to talk about the medial part. So for medial part, try to memorize this muscle which is a center and it's called as a gracilis muscle. This shape structures in middle. Back of that we will have adductor magnus. This is the adductor magnus. In front of that we have adductor longus. Magnus in back, longus in front. And the other muscle which is close to the femoral artery vein, you can see this tiny here. So this is called pectineus. This is the pectineus muscle. So I'm gonna just show you the old one as well. Okay, so right now you're familiar with this. What's the name of this? No, it's the lateral side.
ITB.
This is the ITB. What's the name of muscle? Tensor fascia latae. Tensor fascia latae muscle, ITB or iliotibial band. And here you can see the sartorius. You can see the quadriceps femoris. Again, this is the rectus femoris, vastus medialis, vastus lateralis. Vastus intermedius will be underneath of this. Then for medial side, this muscle which is close to the artery and vein is called pectineus, adductor longus, gracilis, adductor magnus. Again, for medial side, it's better to find this one first, which is gracilis. Back of that, we have adductor magnus, adductor longus. Close to the artery and vein, we have pectineus muscle. What's the function of those muscles? What's the name of muscle?
That's the
Adductor magnus. Adductor function will be adduction. Adductor longus function will be adduction. So all muscles, they are going to make adduction for top. Okay, so we are done for this part. New model first. So you can see the gluteus maximus here. So this is the first muscle which we have here. What was the function of this? Do you remember? Function? Extension of thigh is the function of this muscle. Then we will have the muscle underneath of that, which is gluteus
Minimus.
medius. Maximus, medius, this is the minimus. I said we don't need to just practice on minimus, so just maximus and medius. So medius makes the abduction and also stabilize the hip joint for us as well. So in posterior part we have hamstring muscle. So there's 3 muscles here, 1, 2, 3. Lateral side, which we have pinky finger, we will have biceps femoris, and there is 2 head. This is the long head, and underneath of that, this is the short head. Long head, short head. So if I remove the long head, maybe we can see the short head very well. Just change this. Okay. So this is the short head, and this is the long head of that. And the other side we will have 2 muscles. One is superficial, the other one is deep. This one which is superficial is semitendinosus. Half of that is muscle, half of that is tendon. And underneath of that we have semimembranosus. Half of that is membrane, half of that is muscle fiber. Here you can see the line which separates these 2 muscles from each other. And same thing in the other side as well. Can you see the line?
Yeah.
So this is the line which separates the tendinosus from membranosus, which is underneath of that. And finally, I'll just take this out as well. We have posterior part of the leg. The first muscle will be gastrocnemius. So this is the gastrocnemius with 2 belly parts. And this is the Achilles tendon or calcaneal tendon. So here you can see the line which separates the gastrocnemius from soleus as well. But when we remove this part, we have a better view for soleus. So this is the soleus. If you remember, I said there's a 3rd muscle. I'm going to show you, but I'm not going to asking in your test. So this is the plantaris, and this is the tendon of plantaris. So tendon of the gastrocnemius, soleus, plantaris, all together they are going to make the calcaneal tendon. Function of these 2 muscles, both of them, they are going to make the plantar flexion for us. Function of hamstring muscle, these muscles, which we have in here, will be flexion of the leg. Any question?
No problem.
Okay, I'm going to just show you with the old model as well. So it's a little bit different with the other one. So this is the gluteus maximus. This is the gluteus maximus, and this is the gluteus medius. Part of that is visible, part of that is underneath of the maximus. So maximus, medius, and these are the hamstring muscle, those 3 muscles. This one is biceps femoris, long head, short head. So as I said, in your test, you're supposed to memorize what's the name of this part and what's the name of this part. Long head, short head. Long head of biceps femoris, short head of biceps femoris. And for these 2 heads, we have semitendinosus as a superficial, and this is the semimembranosus, which is underneath of that. There's 2 muscles. And for this side, we will have muscles like this. So this is the calcaneal tendon. You can see the gastrocnemius. This part is soleus. And when we remove this, we have a better view for soleus underneath of that. So this is the soleus, this is the gastrocnemius, and this is the plantaris, the 3rd muscle. Okay, so we are done for this part. So,
come on, guys. Education is power. Or knowledge is power.
For you.
okay. So for upper limb, the first muscle, as you see here, is deltoid muscle. The massive muscle, which is attaching to the clavicle, acromion process, and the spinous process of scapula. And main function of that is abduction. Makes the flexion and extension as well, because we have fiber in front, we have fiber in back, and we have fiber in lateral part as well. For anterior part, we will have biceps brachii. Guys, you are so loud. Here we have brachialis. Biceps brachii, brachialis. For biceps brachii, we have two heads. Thumb side is long head. Pinky side is short head. Long head, short head. Underneath of that, we have brachialis. Function of these two muscles is flexion of the arm. In back, we will have triceps. Three head, 1, 2, 3. The massive part is long head, which is coming from the scapula. Long head. This is the lateral side, we call it as a lateral head. This one is the medial side, we call it medial head. Long head, lateral head, medial head. Same thing for old model. So in here, we will have this muscle, which is called deltoid muscle. Then we will have brachialis and biceps brachii. For this one, we cannot remove the biceps, so you can see partial part of the brachialis. And for biceps, can you tell me which part is long, which part is short?
The thumb side is long, the pinky
This is the
side
thumb,
is-
so this
is
is
long,
the
yeah.
long. Pinky is over there. This will be short. Long head, short head. Function for both of them is flexion of the arm. And in back we have triceps. So for triceps, 1, 2, 3 heads. Middle part is the massive part. We call it as a long head. So this is the long head of the triceps. This part is in lateral side. It's called as a lateral head. And this part is in medial side. The small part is called as a medial head. Long head, lateral head, medial head. Function is extension of the arm. Okay, so we are gonna just work on it right now. This is the pectoralis major muscle, and this is the pectoralis minor muscle. So here, major is removed, so that's why you can see the pectoralis minor muscle as well. And we have the space between ribs, which is called intercostal area. We have 3 layers of muscles. All of those which are finishing before what's called cartilage are called external intercostal. And those muscles which they are going to start from sternum and coming back, they're going to call internal intercostal. So in your test, there's possible to put the label here and ask, what's the name of muscle? It's pectoralis major, pectoralis minor, external intercostal, internal intercostal. Innermost is not visible. We need to just remove this part to see back of that. For abdominal area, also we will have oblique muscles. So this is the external and this is the internal oblique abdominis. External, the fiber are coming from top to the bottom. Internal, we're going from bottom to the top. Like external pocket, you're gonna use your hand like this. Look at the orientation of my hand. It's coming from top to the bottom. But if you have a jacket and you want to just use the inner pocket, your hand is going like this. So bottom to the top. And in center, you can see 2 muscles which are called rectus abdominis. And there is a line, white line, which is passing between xiphoid process and symphysis pubis. It's called linea alba. In lateral side, this muscle will be serratus anterior. So this is the serratus anterior. That's the only muscle which we can see in lateral side of the trunk. Follow me for this model. There is a 3rd layer visible as well, which you don't need to memorize. So in the first layer, we have one muscle which is called trapezius. Okay, what was the function of that?
Can do
Rotation
abduction.
of the scapula upward, elevation of the shoulder, retraction of the shoulder, all of those functions. then we have this muscle, which is called latissimus dorsi. What was important about this? Why this skeletal muscle in the human body? The function is extension of the arm and also adduction of the arm as well. Then for second layer, we will have three muscles in medial border of the scapula. You can find it. Levator scapula, rhomboidus minor, rhomboidus major. From this levator, it elevates these two. They are going to rotate the scapula downward. They are going to elevate the scapula as well. So for shoulder area, you're familiar with this muscle. What's the name of this? Function of that?
Abduction.
Abduction. So we have a couple of muscles which are extending from this part to the humerus. This is the posterior part of the scapula, and this is the spinous process of the scapula. Above that, we have muscle which is called supraspinatus. Below that, we have infraspinatus. And in medial lateral border of the scapula, we have two muscles. Tres minor, tres major. Take down a model which you saw over there. In right side, we have first layer, and then here we have second layer. For first layer, we have this muscle which is called trapezius. Second layer is latissimus dorsi. Okay, so first layer, two muscles. Second layer, three muscles. Levator scapula, tres minor, tres major. And then we will have a shoulder area. What was the name of this?
Supraspinatus.
Spinatus, infraspinatus,
Tres minor.
tres major, and subscapular suprapubic. And so for your group, I don't know, I showed you the serratus anterior or not. So this is the serratus anterior muscle. In lateral side of the chest, we have only one muscle, serratus anterior muscle. Any question?
No problem.
Okay, please have a seat.